This is the Pest Experience.
All right, good evening and welcome back to another wonderful episode of the Pest Experience show. My name is Shofu Babalola Theophilos. Oh my goodness. So welcome back again to another wonderful, amazing episode of the Pest Experience show. Whatever country, whatever state, whatever city that you are listening to me from, it's been a wonderful time here on the Pest Experience show. Like I said earlier on, my name is Shofu Babalola Theophilos, and I want to sincerely welcome you all into another wonderful episode of the Pest Experience show. All right. It's going to be a wonderful time right now tonight. We're going to be talking about amazing stuff. I'm sure you must have been seeing the banners and flyers every single where that you are currently listening to me from. As a normal routine of what we do on the Pest Experience show, first thing first is to sign in with your name. Let's know where you are joining us from. Let's know the part of the world, the name of your brand if you're a pest control operator. I can give you a free shout out here on the show. Right? Well, we have wonderful time on the show tonight. Last week was World Mosquito Day, and we were supposed to have one of our major guests on the show, but fortunately enough, we had a show. We had a wonderful time sharing our experiences in terms of getting rid of mosquitoes in different apartments, what we need to do, who are the people that are responsible for these things, and what are the action steps that we need to take to be able to solve this problem or curb this menace in our society. Well, tonight we are going to be looking at this major aspect with amazing experts in the industry, and not just in the pest control industry. He is an advocate. He is a wonderful person. He's doing a wonderful job. In fact, when I selected this topic, I was so led to him because he has done wonderful works and to be able to solve this mosquito problem in his own capacity. Well, without further ado, I would introduce him, and as we go along in the show, he would introduce himself directly to us. All right, so as I said earlier on, welcome back again to another wonderful episode of the Pest Experience show. First thing first, we have a major topic. The topic that we're going to be discussing tonight is a major question for every person, everybody. It's a major question that everybody needs to answer. Everybody needs an answer for this question. And the question is, can Nigeria be free from malaria? I mean, that's a very big question because according to the World WHO, Nigeria has over 31.3% of the world's malaria deaths in 2021. It's categorized according to even the Congo, the Democratic Republic of Congo, the United Republic of Tanzania, and Niger. They both have this issue of malaria. Those are the countries that are affected by this malaria. What exactly is major cause of this malaria issue? Let me tell you something. Malaria is caused by a single-celled parasite. It's a single-celled parasite of the genus Plasmodium, which is normally known as a female mosquito, female Anopheles mosquito. That's the major concern, major insects that transfers this malaria pest and malaria disease to man. Right? So we need to look at how do we solve this problem? What are the major concerns? Who are the people that are responsible to solving this problem? How can malaria be eliminated? Can Nigeria be free from malaria? That's the question we're going to be answering tonight. And we're going to be deliberating with it, talking about it, looking into it. And not just only me tonight, we have no other person than Mr. Francis Nwapa, the CEO of Pest Control, and also the convener of the End Malaria in Nigeria. So welcome to the show, Mr. Francis.
Thank you so much, Shofu. Thank you. It's nice being here once again. Thank you. Good evening, everyone.
Welcome. Fantastic. It's a normal routine on Inside Radio. If you're listening to us from Facebook, if you're listening to us from InsideRadio.net, all you need to do is go straight down to the chat box, sign in with your name, and let's know where you are joining from. If you're in Lagos, if you're in Nigeria, if you're in Congo, Tanzania, UK, wherever state, whatever country, you would be able to hear us directly. Just sign in with your name and let's know where you are listening to. Wherever state, let's know where you are joining us from. Okay, so I will be reading out. But let's go straight down into the show tonight. Welcome again, Mr. Francis. Why exactly, what exactly is this malaria?
Thank you so much.
So let's dive in. What exactly is this malaria routine? Tell us.
Once again, I want to say good evening to all our listeners, wherever you're listening from. I want to say good evening, good morning, good afternoon to everyone. We are here to discuss the most deadliest, disease in the world, which is malaria, that has almost little attention or seriousness in eradicating it. Malaria, just like you have rightly said, is a tropical, acute, and chronic life-threatening parasitic protozoan. Disease characterized by fever. It's transmitted from one person to another through the bite of an infected female Anopheles mosquito. Which is the only known vector. As of today. And of course, it transmits a protozoan of Plasmodium genus. The most common species that we have in sub-Saharan Africa here is the P. falciparum, which causes over 300,000 deaths, annually in Nigeria. And I think hearing this figure should give everyone a concern as to why we must all come together to fight these killer disease.
Fantastic. So the major problem, the major issue about malaria is exactly mosquito. Last week we celebrated the World Mosquito Day, and you carried out a major project, which is one major thing why I selected you to be a guest on this show tonight, which is the project you treated for 300 pregnant women in Delta, which is a fantastic project. We'll talk about that, although we briefed into that last week, but we'll also do a brief about it this week for people who are just joining into the show. Let's look at the topic. The topic says can Nigeria be free from malaria? Why Nigeria? Why exactly is the major concern in Nigeria? Can't other countries, and what exactly is Nigeria doing to be able to solve this menace, to be able to curb this menace, which is the malaria?
Well, thank you. For a country like Nigeria that has the highest ratio, mortality ratio in all ramifications, it calls for concern. Nigeria records over 100 million cases annually. Nigeria, as of today, has 30% of childhood deaths from malaria. Nigeria records about 25% of under 1 year old child deaths, and also 11% maternal death rates, annually. And so such ratio should give us concern. In the course of our intervention, which you talked about, I ran into some persons, and while I was rolling out this figure, and they say, how do you know that? How do you come about all these figures? How do you know? I say it could even be more, because we live in a society where statistics are not being is not considered seriously, and also yes, and and also where cause of death is not scientifically ascertained. I mean, most of the cause of death are attributed to spiritual, spiritual issues and all that. But when you carry out a scientific investigation, as to the cause of death, you find out that most, because when in our course of interaction with the primary health care, the central hospital of the places, I mean the local government where we carried out our intervention, I mean, the highest record, the highest number of people who comes to visit the hospital are malaria cases. They are malaria cases. Over 70% of the people who come to hospital because of malaria. And so how why should we not take this serious, and why should we not see that there is need to declare a state of emergency on malaria? And in declaring a state of emergency on malaria, it means that we need to declare war on mosquito. And so, in taking up that, it means that government needs to take the fight seriously by, putting certain things which we will be discussing in the course of this interview. In the last program, I made mention of in the 60s, we have companies that do construct our drainages here in Nigeria. I remember, I think Niger also was a major company that used to construct our drainages, in Nigeria then, as well back as then, where drainages are constructed in such a way that water can flow. You have a central place where the water flow to. But today, in the invention of the politicians into the politics of Nigeria, the construction of drainage is being awarded to party faithfuls and all that, and it's used as a compensation where people just come, they just create a ditch on the side of the road, and water flows and stops. The water has nowhere it's flowing to. So it becomes a breeding space for mosquitoes. And there's no way you want to fight mosquito without controlling water, without managing water. And so these are the major issues that need to be addressed if Nigeria government is serious about fighting mosquito.
Speaking about drainages, let's look at the aspects of the major causes. Now, you made mention of mosquito, but there are still some factors that needs to be considered in terms of the killer. The killer is actually, I love this tagline that PECAN, which is the Pest Control Association of Nigeria, did during the World Mosquito Day, and they named it "Fighting the Killer," right? World Mosquito Day, fighting the killer, something like that. So that aspect of fighting the killer is my own major focus for this question I want to raise, which is, mosquito is the major concern. Yes, I agree. But there are some factors that need to be eliminated, like what you said in terms of drainage. So what other factors apart from the drainage, or during drainage, is that the wholly major concern to this malaria? Because I see this as a ladder. If you can kill mosquito, you'll be able to eradicate malaria. I think that's the best way. So now, for you to now go back into mosquito control, there are other things that we need to look into deeply. So what are the major other aspects that you think that we need to look into?
All right. We have our campaign over time has been on preventive, which we have always pushed. The water management. Waste management is a part of it, because in fighting this dreaded disease or insect, because mosquito does not just transmit malaria. There are other diseases like dengue, like Zika virus. Name it all. They are there, and so it's not just the malaria. And the yellow fever and all that. So in fighting this particular pest, there is need for one. It must be an integrated vector management approach. Where we combine all kind of methods to ensure that this vector is tackled. Waste management, we need to manage waste properly, because most of this waste, Nigeria still practice open dumping. This waste receptors to receive water, and when it rains, they receive this water, and it becomes a breeding space, a breeding site for mosquito. Now, we must also understand that for agencies and residents to be able to reduce mosquito population, they must also know the habits and the behavior of the species of mosquito that is present within that environment. I repeat, for agencies, we have over 3,500 species of mosquito. For agencies and residents to be able, they must be able to know the species, the behavior, and the habits of the species of mosquito, within that environment. And unfortunately, Nigeria does not have. Do we even know the species of mosquito we have in Nigeria? Do we know?
That's a big question.
There are no research. There are no research into that. There are no research that I'm aware today as to ascertain the species out of all the 3,500 species of mosquito we have. There are no research, that ascertain the species of mosquito that we have today. And so that is why, as part of our recommendation to government, is that our universities should be empowered with laboratories that can research into species of mosquitoes. Government should fund these laboratories where we can ascertain that this is okay. If we have a species of mosquito that can transmit Zika virus, for example, in a particular location, how do we know? How do we know to begin to take precautionary measures to curtail or to mitigate the transmission of such virus, within that environment? We don't know. The only time we know is when somebody has fallen sick or somebody died. There is a mortality as a result of it. But we should take prevention, and part of the prevention is for us to empower our research, institute, to ensure that we are able to ascertain the mosquito in this particular locality, and also to help the health care facility, that when a malaria case is declared, that we have all it takes. We have our health facility has what it takes to treat, not just treating, but to also ensure that there is no further transmission of that particular of malaria within that environment. We have all it takes to do that. And so that is why we said water management, we've talked about waste management, we've talked about empowering and enhancing and proper funding of our laboratories, and also our healthcare facility need to be properly, workers need to be remunerated to be able to, work effectively. Imagine if malaria is the highest number of cases you have in the hospital, and you're having perhaps in a particular general hospital, you're having over 10,000 people, and you're having just 2 doctors to attend to such number of cases. So our healthcare facilities is overburdened, by malaria, and all that. It's overburdened, and so for us to reduce this, it means that we need to come back to proper vector control, ensure that the vector that transmits this disease that overburden our healthcare facility, that vector is taken care of, and so it reduces the burden on our healthcare facility.
Fantastic. So there are a lot of processes that needs to be looked into, which is what you said earlier on: waste management, water management, and ensuring that the people are properly educated about different tasks. But speaking about, you said something about there are already things that are available for us to be able to get rid of this menace, this problem, which is mosquito. But looking at that aspect now, who are the people that are responsible for an effective control of this killer, which is the mosquito? Who are the people that are responsible? The government. I know you have mentioned of governments, healthcare centers, and agencies. So let us go into it in detail. Is it the government? If it's going to be the government, what aspects, what major focus are we calling the governments to be able to handle? Because we don't know. Maybe someone in the government who is responsible will be able to take this as a case study. So let's dive in.
All right. Basically, the primary responsibility falls within the purview of the government. As at last year, I know our organization did an article where Sokoto government spent over 531 million naira on purchase of mosquito nets. Purchase of mosquito nets. Such humongous amount could have been diverted to proper construction, proper drainage construction, proper water management, but it was diverted to purchase of mosquito nets. And so it is about government wrong investment. So it's about government, not making preventive measures a priority. So you will find out that even such amount, a large chunk of that amount had gone into private pockets, and all that, rather than using it to, to prevent this. And so I must stress first, secondly, that malaria has become a burden on the working class, the poor people of Nigeria, because an average Nigerian person, an average Nigerian working class person, spent between 7,000 to 10,000 naira on every malaria breakdown, averagely. Because just last week, I had to run a test for someone. Send money to someone to run a test, and he used 8,000 naira to run the test, and he used they spent another 9,000 naira for medication. That is about 16,000 naira just gone for tests and medication and for the drug. So that is 16,000 naira. That is just one breakdown of malaria breakdown. What if you have a repetition of that for like 2, 3, 4 times in a year? You're talking of close to 80,000 naira annually on malaria alone. We're not talking of any other health issues and all that. So it is a huge burden for the Nigerian people, and government has a major role to play in ensuring that the little minimum wage, the little money that the average Nigerian worker is getting is not going into malaria treatment. All going into malaria treatment. And so government has the major, through its agencies, the ECON is a vital organization, agency that government should, through ECON, begin to adopt environmental, alter the environments. Just like I said, the malaria mosquito breeds in a dirty environment, where we have stagnant water and all that. So government can, through ECON, begin to empower our environmental health officers, begin to help in planning our environment, and not depending on medical doctors to control malaria. No, the environmental health officers has a major role in the control of malaria. And so government should begin to see it that way, rather than projecting medical doctors.
Very good. Very good. The government, number one, and the environmental officers, number two. Great.
So I think the government has a major role to play, and it all falls within the purview of government. Because when you look at other countries that have been declared malaria free, when you look at those countries, the government played a proactive role. It wasn't left for private individuals. No, it's not a private responsibility at all. The private does not have the resources, does not have the paraphernalia to lead such a campaign and such a major fight. It is the government. It's just like leaving the fight. Look at all the countries during the COVID-19. Look at all the countries that had COVID-19. Was it the private individual that were fighting COVID-19? No, it was the government of those countries. They were playing major role. Yes, you can bring in private sector to come and support, but the government has 95%, of the role. Who gets the statistics? Who comes with the plan? Is the government. The plan of how to build a society in such a way that water is properly controlled. It is the government. It is the government who builds a central collection point where all the waters that comes from each house goes into a primary drainage. It is government that builds such such a society. So it is the major responsibility of government through its agencies, especially the Ministry of Environment, Ministry of Water Resources, urban planning, and etc., to ensure that our society is properly planned, that we don't have a society, a disjointed society, a disorganized society where our water flows. When you go, look at the environment where we went for an intervention.
Yeah.
In less than 10 minutes, the whole environment was submerged in water.
Wow.
In less than 10 minutes rain, the whole environment was submerged in water because there were no drainages at all. So when you look at such, and this is an oil producing a community where you have all the big and mighty oil companies and all giants and all that, and this society is still not planned. So it's not about whether the society is starved of resources. No, it's not starved of resources. The resources are there, but it's just about government having the right persons in leadership to ensure that malaria becomes a thing of the past in Nigeria.
Fantastic.
And that is what we are pushing towards.
Fantastic. You said something now. You said about having a collaborative system. So, number one, you made mention of the environmentalists, the ECON, and also the government. Yes, through the ECON, just like what you said, should be able to. They are responsible for an effective control of mosquitoes in our environment. So, speaking about that, these people need to come together. They need to come together. The waste aspect, the water aspect of the environmental, the Ministry of Environment needs to come together and be able to provide a lasting solution. I think that's a fantastic one there. So you mentioned also about the project you did in Delta. I know we discussed about this last week, but for people that are just listening to us now, they want to know about this because I've been mentioning about the project you did in Delta, which is fantastic, right? So let's give us an overview of what that place is. If, for example, there is a drainage in that area, what advantage will it give these people that are living in the Delta aspect, or even in other states too? Just as you said, if there is a proper drainage in those places, what exactly do the government need to do? How do they do it? This is an opportunity for us to be able to talk to the government, recommend ideas to them, and not just throw blames at them, because some of them are literally filled up with a lot of tasks. Although it's their responsibility, yes, I agree 100%, but we also on our own parts needs to recommend, okay, this is what you need to do, this is how you need to do it, right? So now this is an opportunity for us to recommend an idea or ideas of what they need to do. What do they need to put into place to be able to solve this problem?
Okay. Firstly, there's something I do say. I say malaria is majorly a poor environmental thriving problem. When you ask a man from a curative background to solve a problem that should have been resolved through prevention, he will simply make prevention appear difficult. So,
Yeah.
so
Yeah.
most of the people, when you talk about malaria, the government always look at malaria from the curative aspect. And so when they want to resolve the issue of, when they think they want to resolve the issue of malaria, each time they run towards those within the curative background. And so those within the curative background makes it appear as though it is a very difficult thing to resolve. You have to continue to use your drugs, continue to use drugs and drugs and drugs and drugs, and there is no solution to it. And so we are saying it is not a curative issue, it's a purely environmental issue. And so government should pay more attention on environmental issues. So when you take care of the environmental issues, then it becomes lesser burden on those within the curative aspect of health. You get it? And so, so the intervention we had, like I told you,
Yes.
from our research, from our investigation, we are compiling our full report on that program intervention. Our intervention revealed that virtually 95% of pregnant and nursing women who comes to the hospital are coming because of malaria breakdown. And when you're pregnant, when you're pregnant, you don't just use drugs. You just have to go to a medical facility for you to for you to be examined, so that you don't use drugs that will affect the baby. And so most of these people most of the problem they come to report is malaria. If you watch some of the interviews we did to some of them, some were saying that they break down even 3 times, 4 times in 3 months or in 2 months, because of malaria. Because of mosquito and all that, and so that particular program came out of the burden I had, as a result of the malaria issue we have, looking at the statistics of Nigeria when it comes to malaria mortality. And I discovered that this mortality was high when it comes to pregnant and nursing women and children below 5 years. And so I felt that the only way for me to make my own little intervention is for me to carve out this section of the populace and see how we can intervene. And so I began to reach out I presented it to my team, and we thought of it. We said, okay, can we look at partners that we could bring in? And so the first partner was the MPI, the Malaria Partners International, and we reached out to them, and they saw the proposal and it was okay. And also our partners in the Rotary Club of Kwale. And so we came together alongside with our own organization, Hatch Pest Control, that handled the treatment itself and all that, and the training of the personnel that were used. And so we came together to carry out this intervention in Delta State. It was a very long, daily engaging war against mosquito. And so we were going in from community to community, from home to home of these pregnant and nursing women, and we were carrying out indoor residual spray. Indoor residual spray entails impregnating the internal walls of their homes with certain chemicals that when mosquito perch on that wall, the mosquito dies. It can last between 3 to 6 months. And so this was the intervention we took to Delta State. And It all went on well. We are back now to Lagos. It was a challenging one, but it all went on successfully.
Fantastic. I feel like that's a fantastic project because um, you made mention of when I was asking about what people that are responsible. You made mention of the government. You made mention of agencies. You made a mention of private body, and these are ways that private bodies, private organizations can actually step in. They can't do more than this. And I will agree with you totally that the major aspect, 95%, according to what you said, aspects, 95% control of this pest, which is mosquito, and also the malaria disease, is the government. Government needs to take action. Government needs to call a state of emergency towards this because it is taking too much of our people out of this planet. And we need to come together to be able to solve this problem. Unity is a major control method in solving this problem. Now, when you started the program, you made mention of how this project, has worked out for 300 pregnant women in this aspect. So now, from a perspective of these particular people, I mean, those people that are out in Delta State, what are their major control method that they've been using? What was the method that they've been using to solve this problem in their own home?
Well, it was a challenge, a major challenge that they had to adapt to. Uh, uh, some of the homes, few of the homes we went to that the occupants were able to afford the normal insecticide. Well, it was a method they adopted, but majority of the homes where we carried out this intervention could not even can't afford to feed themselves, let alone buying insecticide. And so they were living with the mosquito that way. I saw some of their skins. Some of their skin were having, you know that they have been beaten by mosquitoes and all that. Because when you see the houses without roofs, houses without windows, without doors, so it becomes a regular thing. And it's disheartening, that you have a baby living in those houses, in those homes. It's so disheartening and heartbreaking that you have kids living in such places where they call home. They are not homes because the roofs are open, the windows, the doors, they are open. They have, I mean, it's an open invitation for mosquitoes to invade such places and all that. So there were no means of control. There was no means of control for them, and so it was a very timely intervention for them when we came. They were so happy. They were, I mean, a lot of them. I mean, in one of the village where we went to, the mama, the woman that had the woman that had the baby was not around, but the grandmother who was around came and gave testimony of how they slept. They have been sleeping, without mosquito since the spray, since we carried out the RRS in the apartment, and a whole lot of them like that, and this is just a little intervention from us, but we want government to take up the major responsibility to ensure that our babies are protected, our nursing women are protected. I mean, our pregnant women are protected of malaria. This is a period where their immune system is very low, and so malaria is a huge challenge to them. Aside that, there are a lot of people who have also contacted cerebral malaria, and a lot of them are in mental homes, because of cerebral. We need government to rise up to its responsibility, and we need also corporate organizations. We need, international organizations to collaborate with us, with organizations like us, to continue to push this campaign and to carry on interventions like this in various communities. Not just, we have about over 700 local governments in Nigeria. We will be happy to carry out in each carry out this intervention in each of these local governments to reach out to this, to this uh, women, this section of Nigeria population, this scope, this within that scope, and intervene and stop the mosquito, the malaria mortality, within this group of people annually.
I feel like if you have people just like you in different localities, if you have people just like you in different local governments, just like what you did, you treated 300. So if in a local government, you have like 700 local governments, more than even 700 local governments in the country. So if we have 700 of you in different local governments areas like that, I think we'll be able to collaboratively solve this problem as a corporate body with the support of the government. So my own question to you is that, do you think the government should implement this same strategy that you did? Do you think it's important?
Yeah.
Yes. Do you think it's possible?
Yeah, just like I said earlier, it's an integrated approach.
Yeah.
It should be an integrated approach, not just the indoor residual spray. Firstly, we've talked about water management. When you look at most of the countries that have been declared malaria-free, we have over 10, about 11 countries in Africa alone that have Lesotho, and the rest of them have been declared malaria-free. Algeria in 2013, these are countries that were declared malaria-free. And so when you look at what they did, and then we need to take a cue from them. The most prominent things they did are these things I've mentioned, ensuring that water is properly managed. So government has a major responsibility. Now we have new ministers in Abuja, and most of them, we have Minister of Works, Minister of Environment, most of these ministers should come together. Executing projects should not be for profit making. It should be for providing social services for the people. They should come together and ensure that there is a policy. That Nigeria, there should be a policy on water management, drainage construction, dam construction. Like I told you the last time we spoke, by September, October, Cameroon is going to release another water from their dam.
Yes.
And it's going to cascade all through into the riverine areas, down to all these communities. And that is another breeding space for mosquitoes again. What is government doing to ensure that when Cameroon releases that water, that it does not disrupt the living, inhabitants of the people within the areas that will be affected? What has government done in the last 1 year to ensure that this flood, the flood is taken care of? So these are areas in which government need to take critical action, ensure that the life of every Nigerian matters. We want to have a Nigeria where malaria will no longer be an issue. Malaria will no longer take the life of any Nigerian. That is the country we are projecting. That is the country we want to have. And so if government can implement integrated approach, ensuring that management waste is properly managed, water is properly managed, our research centers are up and are properly funded, where we can make research as to species of mosquito, make research as to their means of transmission, make research in various areas. So it is only when you have a proper knowledge of that particular pest, the behavioral pattern, the habit of that pest, that you will be able to deal with the pest. And so research is very, very vital in fighting in the fight against mosquito. Then we also talked about enhancing and expanding our medical facility, our healthcare facility. Our healthcare facility, as it stands, is second to none. It's zero. It's zero. Our healthcare facility is zero. That's the truth. For everyone that goes to do tests, what is the result you come out with? They tell you malaria, typhoid, and how do you even ascertain who owns malaria? Mind you, Nigeria doctors I mean, our medical facility does not treat. We don't treat malaria. We only subdue it. We only subdue it. And so when after some time, you see a resurface, and that's why in a month there are some people that have malaria twice or 3 times in a month, even after using medication and all that. And so there is need for us to enhance our health facility. Then don't forget that Oxford University came up with the R2S, vaccine. How has our own universities been empowered to carry out research, to even start practicing in vaccine production? Even our own agency, Nigeria Vaccine, Center, is being abandoned. So how is government empowering this vaccine center and our universities to produce vaccine that can help in taking care of rather than depending on other organizations? And let me say lastly that there are other areas, there are other ways of controlling. It doesn't have to be chemical. We have biolarvicides.
Exactly.
We have biolarvicides. We have plants.
Coming to that too.
We have plants.
Great.
We have plants that can take care of a mosquito. The impact of mosquito. In Nigeria. But why are we not looking at it? Why are we focusing on just drugs? And just because some individuals are where they are, they just want the pharmaceutical company they reap billions out of Nigeria. Imagine if we have over 200 million Nigeria, and we have malaria once in a year, and we spend just 1,000 naira to treat malaria. 1,000 naira times over 200 million. We are talking over 50 billion. Such amount could have been channeled towards developing our society and ensuring that mosquito is taken care of. But attention is not being paid, and that's where we are calling on government to begin to take malaria elimination serious. The Nigeria Malaria Elimination Council, it is not just about funding these organizations. It's not just about funding them. What are they doing? It is when I'm happy that it was when our organization began to push the narrative of prevention, that certain agencies, certain organizations begin to wake up to their slumber and begin to make noise. But the right thing is still not being done. Yeah, just last year, the former president inaugurated Nigeria Malaria Elimination Council, headed by Aliko Dangote, Otedola, and the rest of them. Up till now, nothing has been heard of that council. Just like we told them that it's a white goose chase. Calling people like that to come and oversee mosquito.
I feel like they should have invited people in the health center, into the system, right? So if people, I love the way you sound. You are so energetic about this problem, and you're full of energy in getting rid of mosquitoes. If they give you the power today, you're like lion that wants to go and jump on everything and solve the whole problem. Honestly speaking, the energy is there, and people can feel it, people can enjoy it, people understand the pain that you feel. I feel like if you have people like you, right, in the econ space, in the pest control association space, we'll be able to solve this problem without even thinking twice, right? So it's a collaborative effort. The regulatory bodies need to come into and sit down into this. It's beyond educating the public once in every year. It should be something that you do maybe virtually every month, every day, every time. Everybody needs to be educated. What exactly is the media doing to solving this problem? The media also has a role to play into this, honestly. The programs that they bring on their radio stations, on their social media handles, Are there educative insights to be able
Yeah.
to solve this problem? The media also has a role to play, and that's exactly what we are doing in Inside Radio, to be able to provide this information through online webinars, trainings, sessions like this, programs like this. In fact, the major goal of Inside Radio, why Inside Radio was actually set aside, is that we are focused on providing environmental solutions in the environmental sector, health and safety, family, and also the pest control. Right? Even if we have entertainment shows, all those things are just side attractions. But these are the major focus. This is where we are focusing on, to be able to solve this problem on a daily basis. So if you come into Inside Radio, even in the middle of the night, you'll be able to hear one or two insights about environmental solutions. And I feel like if we have more people looking into this kind of strategy, we'll be able to solve this problem beyond just the financial scooping of money, like what you said. So we use a collaborative effort. The government, the media, the agencies, we need to sit down together to be able to solve this problem. I mean, it's been a wonderful time on the show. Wonderful, amazing time on the show to be able to look into this and let's solve it together. So we just have 4 more minutes to go before we end up the show. Is there anything, maybe just in 1 or 2 minutes, you want the listeners to be able to take home out of all this? So, like I said, is that just we just have 4 minutes to wrap up the whole show tonight. So we just have 4 minutes, like I said. What exactly would be your parting words for? What exactly would be your parting words?
Well, firstly, I must commend Insight Radio, and I must confess that you are doing a great job. It's very unique. It's very unique to have someone looking in this direction. Most people want to do what will give them so much money, but you took an exception, in what you're doing right now. And I must say that you're going places. You're going places with what you're doing. Your Insight Radio. I want to appreciate Insight Radio, because most media. I'm saying this because you raise the role of media, in making sure that this is taken care of. Don't forget that the media is also in a way being regulated by those who are promoting curative measure rather than preventive measure. And so it is only people like you, media outlets like you, that can promote what we are talking about. Just a few media out there that push most of our news, aside the Sahara Reporter and some of few people who promote what we do, in calling government to to do the right thing. What I would say is that, in my parting word, is that Nigerians should rise in unison for us to fight this disease. This disease has been a problem even before a whole lot of us were born, and we must not allow it to continue to be a burden. And what it means is that there is need for us to come together and ensure that the right things are being done, the right people are being put in government seats. And we continue to push the narrative of prevention rather than curative, because even the drugs we are using for curatives are even dangerous to our body. So we must not continue to use drugs until the tissues and the organs in our body are depleted, and so we must begin are damaged completely. So we must begin to push for preventive measures. Can Nigeria be declared malaria free? Yes. 10 countries in Africa have been declared malaria free. A country is declared malaria free when the country has proven that there has not been local transmission, local case of malaria for 3 consecutive years. And is it possible? China, it took China 70 years. It took most of these countries 70 years to be declared malaria free. And so, as Nigeria, as Nigeria be declared, as Nigeria started the roadmap to being declared malaria free, no, we have not plan in place. And that is why people like us are saying we need to have a plan so that we will say by this time, so year, Nigeria will be malaria free. Thank you.
Fantastic. Thank you very much. That's a wonderful one. My name is Shofu Warolati. I'm the host of the Pest Experience Show, and the voice you just listened to is the voice of Mr. PCO Francis Nwapa, the CEO of Arch Pest Control and also the convener of the End Malaria in Nigeria. Thank you very much for listening. Have a wonderful night.
This is the Pest Experience.